Hi there, everyone. I'm really excited to be here today to tell you about a study that we've recently published in Clinical Teacher called Behind the Screen Exploring Trainee Experiences with Consultant Involved Conflicts Through Reddit Narratives. And yes, you heard that right, Reddit, the social media site, which is one of the things that makes this study pretty exciting and on the unique side. So, what we're looking at here is trainee experiences, so the perceptions of trainees with consultant involved conflicts. So, trainee consultant conflicts, yes, but anytime a consultant was involved as a witness, as a mediator, even as a supporter of the trainee through some sort of disagreement in the learning environment. We ended up collecting 208 posts and we used a combination of narrative analysis and content analysis. And I'll link the citation to this study below in case you're interested in looking at it further. But you can see here we have a bit of a definition of narrative analysis and the different components that we were looking at for those who aren't trained in writing or have a literary background. And it was pretty interesting, some of the things that we uncovered. So, from the narrative side, we can tell a lot about a piece of writing based on how someone writes it. So, for example, not surprisingly, most of the trainees wrote about themselves as the main character of the story. And that's sort of to be expected when you're writing a story about something that you witnessed or that happened to you. You're going to portray yourself as the main character. However, more interestingly, in about half of the posts, where am I? Do, 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 do. Sorry, down here. In about half of the posts, the trainees captured a hypothesized perspective that someone else had, or mentioned the perspective that someone else may have had. Now, this is interesting because when we're considering conflict, um, conflict always has at least two sides, right? But in these trainee accounts of conflict, well, half the trainees were only capturing one side, not even commenting or hypothesizing about the presence of another side. And that will become relevant in just a moment. Some of the other interesting things that we can look at from the narrative side, only about half of the trainees conveyed a sense of agency to effect change or even have an effect on the conflict, which is also concerning when we're going to get to the conflict management in just a moment. Now, from the content analysis side, we're looking at a couple different things. We were looking at the types of conflicts with which arose, and if you look at the paper, you'll see the different ones we've listed out. Some of them include communication, calling out the culture of medicine, which seems to permit certain types of conflict to resolve and perpetuate. There were certainly things involving hierarchy, which would be expected in the hierarchical world of medical education. Some things, especially with senior trainees, involve the practice of medicine as well. Simple disagreements about the art of medicine, or which treatment route, which surgical route would be preferable, would be best for the patient. Um, and then we also saw conflicts stemming from moral tensions and moral dilemmas. We also looked at drivers of conflicts, which we defined as what caused the conflict to perpetuate. So we had a trigger, but then we had something that kind of made the conflict blow up and become a problem from the trainee's perspective. A big one was self-perception, that the trainee didn't agree with the way that they were being painted, that they were being perceived, that they were being communicated with. They didn't perceive respect. They didn't perceive competence at the level that they appreciated. And of course, this is something that we can imagine in our daily lives could easily lead to conflict, right? If our views of ourselves and our self-worth and our self-esteem and our competence aren't in line with somebody else's. There were also conflicts perpetuated or driven by differences in professionalism, professional norms, professional values, the interpretation of professionalism. Interestingly, with Reddit, there was also a lot of conflicts which seemed perpetuated by the trainee's desire to learn. This was something that struck us as well, considering that Reddit is an open, anonymous online social media platform. A lot of trainees went on Reddit asking questions. This was what happened. I tried to find out in the moment. I tried to navigate. I tried to ask. I tried to learn. What would you have done? How would you have handled this? And that was something that we thought was quite interesting in the age of social media and in the age of the internet, that medical trainees had created these safe spaces or these groups to ask questions, learn from each other, and learn from consultants too, as there were in the comments of the post consultants answering questions as well. Finally, we looked at conflict management. So we have these conflicts that are triggered, that are driven. How are the trainees managing them? And this is when things get a little hairy. Because first of all, we saw a lot of anger, we saw a lot of passive acceptance as well. Now remember that about half the trainees didn't even feel that they had any agency or any ability to manage or change or control the conflict. And this default into anger, this default into a passive acceptance, I guess it is what it is. This quote, medicine teaches you to pick your battles. Certainly is concerning when we're considering things like wellness and resilience in medical education and in medicine in general. As I mentioned, there was a lot of help and advice seeking from the Reddit community. There were attempts to communicate with individuals in the conflicts. There was also avoidance of situations. Like in this quote, trainee describes a conflict perceived between the program director and the chief residents, and made the conscious decision not to pursue the chief role, because that was not a situation that they felt equipped or wanted to handle or knew how to handle. Now, interestingly, getting into some of the take home points now, there was really no mention of learned conflict management skills, especially in conflicts involving hierarchy and power. Now, in medical education, medical education is a field where hierarchy and power are sort of intrinsic. As you go through your training, as you climb through the ranks, um, folks are treated differently. Folks gain certain skills, gain certain knowledge, gain certain responsibility as well, right? Now, that's not isolated to medical education. That certainly does continue, depending where you are, maybe not to the same degree, but it continues that hierarchical difference, those power struggles, um, in practice, right? In consultancy, in attending life. And it's interesting to contemplate that, are we really training our medical trainees to navigate conflicts rooted in hierarchy, rooted in power, where there's unequal hierarchy, where there's unequal power, especially from the perspective of the person who feels that they are at a disadvantage, right? They feel that they have less power. They feel that they are lower on the hierarchy. So that is one of our biggest takeaways from this study. Again, if you're interested in reading and exploring further, I'm going to put the citation below. But thanks very much for listening.